Anencephaly. Anencephaly is the absence of a large part of the brain and the skull. There are three types of anencephaly. 1. Meroanencephaly, where there is rudimentary brain tissue and partial formation of the cranium. 2. Holoanencephaly, the most common type, in which the brain is completely absent. And 3. Craniorachischisis. Craniorachischisis is a very serious neural tube defect, characterized by the combination of anencephaly, absence of the brain and cranial vault, without skin covering, with a contiguous bony defect of the spine, also without meninges covering the neural tissue. Rachischisis. Causes. Anencephaly is one of the most common neural tube defects. Neural tube defects are birth defects that affect the tissue that becomes the spinal cord and brain. Anencephaly occurs early in the development of an unborn baby. It results when the upper part of the neural tube fails to close. The exact cause is not known. Possible causes include 1. Environmental toxins. 2. Low intake of folic acid by the mother during pregnancy. Some babies have anencephaly because of a change in their genes or chromosomes. Anencephaly might also be caused by a combination of genes and other factors, such as the things the mother comes in contact with in the environment, or what the mother eats or drinks, or certain medicines she uses during pregnancy. The exact number of cases of anencephaly is unknown. Many of these pregnancies result in miscarriage. Having one infant with this condition increases the risk of having another child with neural tube defects. Symptoms of anencephaly are 1. Absence of the skull. 2. Absence of parts of the brain. 3. Facial feature abnormalities. 4. Severe developmental delay. 5. Heart defects may be present in 1 out of 5 cases. An ultrasound during pregnancy is done to confirm the diagnosis. The ultrasound may reveal too much fluid in the uterus. This condition is called polyhydramnios. On ultrasound examination of the fetus, the calvaria and brain parenchyma are not visualized. Biparietal diameter and head circumference cannot be measured. A coronal section through the fetal face shows frog-like bulging of eyes and absent frontal bones. An anencephalic fetus has a triangular-shaped face and lacks the anterior region of the skull, both of which can be seen on the sonogram. Fetuses with anencephaly are correctly identified at 12 to 13 weeks gestation. Anencephaly occurs in absence of the cranial vault. Ultrasound findings can be normal until onset of ossification has definitely failed. A first trimester scan at 12 to 13 weeks allows reliable diagnosis and active management of anencephaly. Summarily, how do you identify anencephaly? What are the symptoms of anencephaly? 1. Absence of bony covering over the back of the head. 2. Missing bones around the front and sides of the head. 3. Folding of the ears. 4. Cleft palate, a condition in which the roof of the child's mouth doesn't completely close, leaving an opening that can extend into the nasal cavity. The mother may also have these tests during pregnancy. 1. Amniocentesis, to look for increased levels of alpha-fetoprotein. Alpha-fetoprotein level, increased levels suggest a neural tube defect. 2. Urine estriol level. 3. A pre-pregnancy serum folic acid test may also be done. Prevention. There is good evidence that folic acid can help reduce the risk for certain birth defects, including anencephaly. Women who are pregnant or planning to become pregnant should take a multivitamin with folic acid every day. Many foods are now fortified with folic acid to help prevent these kinds of birth defects. Getting enough folic acid can cut the chances of neural tube defects in half. Thanks for watching. Please subscribe, like, comment and share. Ask questions.